Okay.
Okay, well, it's my pleasure this evening to introduce our speakers. Robin Varnado is the Senior Director of Operations at Erie Family Health Center. And previous positions include the Manager of Adolescent and School-Based Health. And prior to that, Program Director at Horizons for Youth in Chicago. Dr. Elizabeth Feldman is, until her retirement, was the medical director at Erie Family Health Center in Evanston. And prior to that, she served as division chief for clinical health for the Department of Corrections in Chicago. So thank you for being here, and I'll turn the program over to our speakers.
Great, thank you. Thank you for inviting us. We should also mention that Liz and I are both Evanston residents, so we're very happy to be part of this group tonight. I am going to share my screen. At our office, we use Microsoft Teams mostly, so please let me know if you cannot see my screen. I'm going to set this in just a moment to slideshow. Can you see my screen?
That's perfect, Robin.
Okay, great. Thank you. And thank you very much for having us here. We are going to go through our presentation, and then we hope that there'll be some time at the end of this for us to talk. So I'm going to tell you a little bit about Erie Family Health Center from a broad perspective. And we're going to start by talking about what an FQHC is. Erie Family Health Center is a federally qualified health center. In the 1960s, our government, in their wisdom, decided we need to take care of people who need safety net health care. And so they, through the HRSA administration, developed an FQHC status. And so we apply for FQHC status. And what that gives us is this. We qualify for funding under Section 330 of the Public Health Service Act. So you'll see when we get to where do we get our money, in just down in the slides, you'll see that we get some federal funding from the federal government. And Section 330 gives us that opportunity to apply for money and to get money. We also qualify for enhanced reimbursement for Medicare and Medicaid. And the way I explain that is this. If a patient has Medicaid and they go to see a doctor for a basic visit, like a return patient visit, the doctor may get, a private doctor may get about $50 reimbursement for that visit. At Erie, we get about $150 for that visit. And what we do with that money, and you'll see as we move down, we wrap around and we include a lot of services for that money. And that's why they give us additional money per visit. So we get enhanced reimbursement for Medicare and Medicaid to take care of people. And we love Medicaid patients. We enjoy having them, and that is really the bread and butter of our income and our patient base. Our promise to the federal government is then that we will serve an underserved population. And that will offer a sliding fee scale. So if people come to us and they do not have any insurance and they do not qualify for any insurance because either they don't have the documents that will allow them to apply for that insurance in Illinois, or they make a little too much money, they don't get Medicaid, and they really don't make enough money to get private insurance, and then they can apply for a sliding fee scale as well. And so we take care of lots of people in that situation. We also agree and promise the federal government that we will provide preventative services. So that means family medicine services and internal medicine services and reproductive health services to our patients. And it also means that we have dental integrated into our clinics. We have about 30 behavioral health therapists Erie-wide that take care of patients in the clinic. So if they come in for a medical visit, they also get to see a therapist if they need to do that and establish care with a therapist. And we offer substance abuse services. So we have a medication-assisted treatment program, which means if someone has a substance abuse issue, we enroll them in a in a program at Erie that helps to use medication to help them not use substances that they don't want to use any longer. And that includes some drugs, opioids, some other drugs, and it also includes alcohol. So we provide these services for a lot of patients. Where necessary, we provide through our care management program for transportation. And then we have partnerships with hospitals, with both hospitals in Evanston, in fact, with Northwestern downtown, with Northwestern in Lake Forest, and some pretty robust hospital partnerships so that our patients, if you're an Erie patient, you get to go to North Shore regardless of your insurance status, or to Northwestern downtown, or to St. Francis. So that is part of our program as well. We also have a governing board of directors that we're going to talk about in a little bit. The governing board of directors is required by law to be made up of 50% or more patients. So we have a patient-driven board of directors. Now, a little about Erie. We have 13 sites. We have 8 primary care centers, 5 school-based health centers, and two of which are open to the community. So a school-based health center is very much like the one at Evanston Township High School. The difference is we are located in the city in some low-income areas in 3 high school sites and in 2 elementary school sites. And in the elementary schools, they have a door that goes into the school, so kids can come in, and then a door that is on the outside of the building, so community patients can come in. Of course, you know about our Evanston clinic, and then we also have a clinic in Waukegan. These are some pictures of our clinics in and around the Chicago area and Evanston and Waukegan. We're very proud of our state-of-the-art facilities. If you have not been to our Evanston clinic to see it, we are very happy to show you around. This is our branding. This is what Erie clinics look like. And you'll see in the top center of that's the lobby of our Erie Evanston clinic. Currently, we serve about 88,000 patients through about 367,000 visits annually. That is Erie-wide, and Liz will talk to you a little bit more about Evanston specifically in a few minutes. We have 730 paid staff members and over 250 providers. We also have residents, and we do a lot of teaching through programs for medical assistants, for our nurse practitioners, and through our residency programs. These are our patient numbers Erie-wide. Again, Liz will break this down for our Evanston clinic as well. 70% Hispanic Latino, 62% female, 44% under 18. Well, there are 44% female, 41% under 18, and 190 different zip codes. So patients are coming to us from all over the place. Not just in Illinois. We have some patients from Indiana. We have some patients from Wisconsin. So a very diverse and robust group of patients. And now I'm going to hand it over to Liz.
Great. Thanks, Robin. If you can go back to the last slide, I just wanted to underscore the payer mix for a second. So sure. As Robin mentioned already, 62% of our patients do have Medicaid. And then there's a very small percentage that have commercial insurance or Medicare. But as you can see, we care for 27% of our patients who are uninsured. And I think that's just worth underlining in terms of when you think about the dollars that we need in order to provide the highest quality care, really. Okay, next slide. So many of you have walked or driven by many, many times and may or may not know that Evanston Skokie exists. I lived in Evanston for a number of years, and it was quite a long time after that I realized that was the Erie Family Health Center, Evanston Skokie. So it's on the corner of Hartree and Dempster. And it started actually in the basement of the Civic Center back in 2014, I think it was, or 12. Robin, do you know?
I I don't remember.
Okay, anyway,
It was 2014.
2014 with one exam room down in the basement of the Civic Center. And now we not only have this amazing state-of-the-art facility, we did a build out about 3 years ago that led to having 34 exam rooms. And then we have a dental area with 5 dental chairs and a full dental operatory. Next slide, please. And so this is the numbers now for us. We are the Evanston Skokie site. We are located in Evanston, as we said. And I actually, when I was the medical director, I thought our numbers were about 9,000 something patients. So we are already up to 11,000, over 11,000 patients. And in the last calendar year, those 11,000 patients came in for 37, almost 38,000 visits. So that's really, to me, just when you think about it, it's phenomenal. We do have 54 separate languages spoken by our patients. Many of those languages are spoken by a member of the staff as well, not all, of course. And we are even a little bit higher than the Erie average in that 46 of our patients were under 18. I pulled up statistics for both Evanston and Skokie, looking at the ethnic breakdown of our patients. So here at Erie Evanston Skokie, we have about a little over a third that are Latinx. We have 25% are Asian and 13% are Black. So interestingly, the 2019 Evanston data show 16% Black, 9% Asian, and 12% Hispanic. And then on the Skokie side, 27% are Asian. So that matches a little more our patients. And then 8% Black or African American, and 8 to 9% Hispanic. So I think it's very interesting in terms of how we reflect a bit of a combination of those two towns. Next slide, please. So it's really important for you all to know that it's not just that we are a safety net community health center that provides care to our community and to underserved, uninsured patients or Medicaid patients in our area, but we provide highest quality care. It really matters. And Erie has consistently over the years ranked in the top, not just in Illinois, but the top 10% of all community health centers nationally on our clinical quality performance. And I'm gonna break this down for you in just a moment. And actually we are the #1 delivering newborn delivery unit in Illinois. I mean, not a unit, we do them at Swedish Covenant, at Evanston, so occasionally at Northwestern. Yeah. But we are very, very high volume in terms of the number of people who come to us for prenatal care. We have a very amazing OB-GYN team that handle from low-risk patients with nurse midwives, certified nurse midwives, to very, very high-risk medically complex prenatal patients. Next slide, please. This goes through the languages. This is over the whole of Erie. So the majority of our patient-facing staff do speak Spanish, and we have 5 full-time Spanish translators for those that don't. So we also have Arabic, and we have at Erie Evanston, we're fortunate that partly because of our residents, partly because of our medical assistant team and some of our provider team, we do have an Arabic-speaking physician. We have Urdu, we have Pashto, we have Korean. So, but you can see the list here of the other high volume, including Rohingya. And I actually spent a few minutes earlier looking at what the latest is about the Rohingya refugee crisis. And it's still quite active, even though Bangladesh has been shown to be quite welcoming of many of the Rohingya Muslims. It's still a really serious crisis. So as you can see, we care for a very diverse patient mix. 73% other languages make up that last 15%, which is even more than the Skokie school system, from what I understand. Next slide, please. So Robin mentioned that we have a community-based board of directors, and this is part of the DNA of a federally qualified health center, that at least 50% or more of the governing board, this is a governing board, need to be patients. So in our case, we have 52% of our 21 board members, and they have all the usual board of directors committees. So you can see there, including, finance and compensation, and our CEO reports to our president, reports to and is hired by the board of directors. They're very deeply involved in all of the decisions that are made, even if it's regarding a change in hours of patient services. So the board was very, very busy during this whole COVID pandemic because we obviously needed to expand care in order to provide COVID testing and treatment across our centers on a 7-day-a-week basis. And so they were involved in those kinds of decisions. And we'll have time for Q&A after, so if you have any more questions about that, we'll be glad to answer them. Next slide. And also, we couldn't do any of this without a very large group of strong partners. So Robin alluded to many of our hospital partnerships. We're very active in admissions and managing patients at Lurie, as well as Northwestern Adults, both at Lake Forest and downtown. The Vista system up north as well. And then St. Francis, which is the Amita Health System, and of course, primarily North Shore with our Evanston and Highland Park hospitals, and also with Swedish, formerly Swedish Covenant, which many of our patients use very heavily. The closest Erie site to us, by the way, just so you can kind of get it in your head, so there's a Foster Avenue site, which is really at Swedish Covenant or Swedish Hospital. And then there's also north of us is the Waukegan site. Then there are a whole number more that are further downtown, but those are our nearby ones. And then the other collaborators, I mean, we were very, very, very excited to collaborate with Protect Chicago Plus, and we did a series of many mass vaccination events for the zip codes across Chicago that had the lowest vaccination rates for COVID. We've been involved with Alliance Chicago and a Safety Net Learning Collaborative for FQHCs for many, many years. And then the Racial Equity Rapid Response, I really encourage those of you who are working on this health equity project to go and look at what they've done in terms of that's specifically around reducing the disparities related to COVID illness, death, and then also vaccination rates. So these are highly, highly impactful collaborations. Next slide. And then this is my heart and soul, which is that Erie trains primary care providers who then go on to care for our populations. And I'm so proud of the fact that 80% of our teaching health center grads, which is our Humboldt Park site, continue to serve in medically underserved areas, and over 90% of all of our graduates serve in primary care. So we not only provide medical residents their advanced training, we also have a 1-year program for nurse practitioners and certified nurse midwives and advancing nurse practice residency. And then we also train medical assistants in our sites. And what you might be most interested in, we do as of July of 2019, we brought the North Shore University of Chicago Family Medicine residency from their outpatient setting at Glenbrook, which was closing, to come and be able to provide all their outpatient care and learn their outpatient ambulatory medicine at Erie Evanston Skokie. Next slide. So I alluded before to the importance of quality and the high quality care that we're proud to provide to every single one of our patients. So these are our 5 top quality metrics. Our enterprise goals, you can see cervical cancer screening means of those people who have a cervix, how many of them received a pap smear in the previous period of time that was appropriate to their age. And the teal line is the national average. Illinois is yellow and Erie is purple. And of course you can see we're way above the state and national averages. Pediatric immunizations is a bundle of the 10 top immunizations for children 2 years and under. We're ahead of the game there. Prenatal care, how many of our patients enter into prenatal care in the first trimester of their pregnancy? Again, we're well above national average. Depression screening is a depression evaluation for every patient 12 and up at every visit. And that's been more salient than ever during the pandemic. We ask a PHQ-2, which is a 2-question screening. And then if they screen positive, then there's a longer questionnaire that they then fill out. And we may pull in the mental health provider of the day, as Robin mentioned, to then do an immediate crisis intervention if it's needed. And finally, dental sealants, critically important. All of the patients who are eligible, look at the numbers here, we're up in the 90% range compared to just over 50 to 60% nationally and statewide. So I think we have reason to be proud of the care that Erie's providing. Next slide. Oh, that's you, Robin.
Okay, great. So I'm going to talk just a few minutes about Erie's overall mission, vision, and values, and our strategy. So Erie's mission is simply this: motivated by the belief that healthcare is a human right, we provide high quality, affordable care to support healthier people, families, and communities. And our vision is all people living their healthiest lives. Our values, we worked really hard over the past 3 or 4 years to pinpoint the values that are super important to us, and they are social justice. And I'm not going to read all of these. You can read them, and certainly we'll send the slides out to you afterwards. Relationships with not employees, patient supporters, and community members. With you guys, it's important to us that we bond and we form relationships. Impact. We improve the health and well-being of the communities we serve. That is our, at the center of our mission. Excellence, as Liz mentioned, we set high goals for all we do and are uncompromising in patient safety and quality, and making sure that our patients feel like they are getting really great care, which we know they are. And learning, as Liz also mentioned, we invest in ongoing educational support for the doctors of the future and the nurse practitioners of the future and the medical assistants of the future, and we hope that will grow. So learning is very, very important to us. When people ask me, why do you stay at Erie so long? Why have you been there so long? I often say, because I learn something new every single day. So it expands, and it expands to all of us. So we couldn't do what we do without money. And you can see that our patient service, our patient revenue is 62%, with private donations at 7%, 21% makes up our federal grant money, 4% is state and local, and 6% other. About 5 years ago, we have grown our federal grant money in the year of COVID. The federal government has asked us to step up. They sent us tests first. They sent us vaccines first, and they asked us to do some really hard work in making sure people were getting vaccinated and were getting tested. And we'll talk a little bit about that in just a moment. And as a result, they gave us the money to do that. They also realized that in COVID, we desperately need technology in order to support our patients. And so they've also invested in our technological platforms so that our patients can communicate with us fluidly, easily through Zoom or through an electronic platform that is HIPAA compliant and that is integrated into our medical record. So we're really, really happy and with that, and we happen to be going through over the next 35 days a transformation in our electronic medical record as a result of that. And we're just so pleased and thrilled that we received this funding. So our overall budget for this fiscal year is around $95 million. And if you take that and you say 21% of that is federal, 62% of that is patient services, and then 7% private donations, 4% state and local, 6% other. And I want to just be very, very clear that the 7% private donations is huge. And we certainly, even though we get some federal money, we absolutely need people to be involved, and not just financially, but in a lot of ways. And we'll give you some more information on that in just a moment. We are absolutely committed to diversity, equity, and inclusion. You recall that we've lots of people coming into our clinics every day from lots of different backgrounds, and we want to create a culture at Erie that values every single person, every single culture that they come from, and all of the backgrounds. And so we have incorporated DEI values and goals into everything that we do, our values in our strategic plan, and we have a 3-year DEI action plan. Every staff member at Erie gets DEI training, and that is, the name of that training is Equity in the Workforce, and we all go through it, and all new employees go through it. It is very collaborative, and so we are given opportunities to really talk openly and participate openly and hear from one another openly about what equity in the workplace means to everyone. And we sponsor opportunities for Erie employees. Right now, we have 2 Erie employee groups. We call them Erie resource groups. We're going to grow that group. One of them is the Black Erie Resource Group, Employee Resource Group. We're celebrating Black History Month this month, Erie-wide. And if we were on an Erie meeting, my background would have a banner that says Elevate Black Voices. So we are committed to the Black ERG. We also have an LGBTQAI resource group that is doing a lot of really great work. And we are providing opportunities for our coworkers who live within that group to talk to us and to tell us how they feel about working at Erie and how we can support them in their life and in their vocation. So just a quick couple of slides, and then I'm going to hand it back to Liz. Since the beginning of the pandemic, Erie has conducted 50,000 COVID tests. We have administered 100,000 COVID vaccines. We've cared for 10,000 patients plus at this point that have been diagnosed with COVID, and 100% of Erie staff are fully vaccinated. We also, during COVID, while we did some social determinants of health work, we realized that it wasn't enough during COVID. You can remember back to all the long food lines where people just didn't have enough food, and they were losing their jobs. And so what we do now is we screen patients when they call in, and we ask them if they need support outside of just medical support. And every patient almost last year of the 88,000 were screened for social determinants of health needs. We connected 12,800 patients successfully to resources within their community or at Erie. The average number of needs identified by each patient were 2 of that 12,798. Of the 85,000 who we screened, 19,000 of them requested resources, and we successfully connected 12,800. You'll ask what the difference is. You know, as you can imagine, we can screen people and we can give them resources and we can try to connect them, but sometimes they are not able to make that connection. We continue to reach out to the difference in those patients, that 7,000 difference, and we continue to screen every single day. And through our social determinants of health work, Erie provided over 3,000 boxes of fresh produce and greens for 1,660 families. I'm really proud of that because it's so out of bounds of what a normal clinic would do. And we know that patients are healthier when they have food to eat and they have healthy food to eat. So handing it back to you, Liz.
Great, thanks. Next slide. So I'm really glad that Missy Fleming is here tonight with us, because one of the things that we have had at Erie Evanston Skokie, which has been a little difficult to sustain during the pandemic when everything went virtual, but absolutely is an important piece that we rely on, is a group called Friends of Erie Evanston Skokie, who help to raise up and talk about Erie's work throughout our local community and help us with events and fundraising and advocate for Erie in any way they can. And Missy and Kathy Tisdall are the co-chairs of the Friends of Erie Evanston Skokie. So when we're almost through with this presentation, Missy, if you want to add something here, you'd be welcome to. So we would really love for the League of Women Voters of Evanston to be connected in to get our updates, just get emails from us, which include action alerts, and I'll talk about that in a moment. And there's the Connect Up URL, which we're going to send these slides out. Of course, as Robin said, we are absolutely dependent on private donation, and philanthropy is a big part. I'm now also coming to you as a representative of the Erie Foundation Board, and we really do depend on philanthropic donations to help us. That can be done in a whole variety of ways. We have an annual gala called Iridescence. We have healthy running and walking and biking teams called Erie Moves, which was really fun to do last fall to raise funds for Erie. And basically people are welcome to donate as, on behalf of or in honor or memory of someone. In terms of this, we did provide COVID vaccines to some of our local neighbors at Valley Produce, at Dance Center Evanston, at some of the small industry businesses right around our office, and welcomed anyone from those organizations who wanted to, those were done for free, of course, but who wanted to donate to Erie Evanston so that we can continue the work that we do. So it's absolutely critical, and we really would love to, as Robin said, kind of extend the relationship between Erie and League of Women Voters to talk about ways in which you and your members might be involved with helping support our work. Next slide. So here's one example of an advocacy alert, although I am glad to say that the particular bill that we're trying to support is co-sponsored by my state rep, which is Robin Gable. And I know Kelly Cassidy was on it, but I didn't see Jennifer Gahn-Gershowitz. I did not see a couple of the other names of the Skokie state reps. So this is just a specific example of something that really, really matters to Erie. So there's a program. It's called the 340B drug program, which makes a huge difference in our patients' ability to afford medication. So when a patient was released from the ICU at Swedish, a patient from Evanston, and called in and said, they wrote a prescription for me for my insulin, and it's going to be hundreds of dollars and I can't afford it. He was calling for his wife. He said, I can't afford it. I said, well, let me re-enter you into it had been more than a year since his wife had been at Erie. But when I put her in the system and gave her an appointment so that she just needed to have an appointment within 13 months, the 340B program kicked in and the insulin cost $12. So the money that our patients save actually, and this is too complicated for me to even possibly explain to you, but basically Erie gets money when our patients use the 340B program to save money on their medications. And that supports things like our case and care management services, benefit navigators, some of our telehealth services, as Robin talked about, our medication assisted treatment. But the pharmacies and the insurance managers are trying to reduce the number of medications that are available under the 340B plan. And there's a bill, House Bill 4595, which would prevent disruptions in care by people trying to pull out of 340B. And so if you are not a Robin Gable, if Robin Gable or Kelly Cassidy aren't your state rep, I encourage you to ask your state rep to co-sponsor House Bill 4595. And you can click on that link and it'll take you to the request for the House bill. So that's just a very specific example of something that garners Erie, what is it, like a couple $100,000 a year out of 340B, Robin?
Mm-hmm. Mm-hmm.
So it really makes it possible for us not only to care for that individual patient whose medication will now be much more affordable, but then to expand our services. Our HIV/AIDS service, I just want to highlight for one moment. So we are very active in doing something called PrEP, which is pre-exposure prophylaxis for people who are at high risk for acquiring HIV/AIDS. And we identify people within our all of Erie who may have, like, say, had a sexually transmitted infection in the previous year, and we reach out to them proactively through our HIV, through our what's it, Lending Hands for Life, Lending Hands for Life program. And those managers of Lending Hands for Life will explain to somebody that if they are at risk for HIV because they're having unsafer sex, that they can take a medication ahead of time that could prevent them from becoming HIV positive. And so that's just a small example of what we do with our 340B funding. So I think that might be the last slide. Let's see.
That is the last slide. So I'm going to stop sharing my screen now.
Great.
So we can see one another.
So I know, Betty, you were monitoring the chat to see if there were questions that had come in, and we're happy, Robin and I are happy to be very informal about this, if however you want to do it.
How do patients know about our services? Do we advertise? And do we attract patients who are in need? So yes, we do advertise. I remember when we opened our Evanston clinic at when we opened our Evanston clinic in our current location, we printed about 20,000 door hangers, and we went out and we put hangers on doors. We advertised through the hospitals, and so the hospital teams know to refer patients to us. That's a big referral source. We advertise through community partners. So we are part of community nonprofit organizations that get together once a month, and we really publicize our services within the community. Do you guys know the Moran Center? So the Moran Center, Patrick Keenan Devlin and I have become good friends. He texted me last week and said, I've got a client that absolutely needs to get care. How can I get him in? We were able to get him in immediately. So there are things like that. We work very closely with the Chicago Coalition, not Chicago, Connections for the Homeless. And especially during COVID, we were able to go to them, and they came to us for vaccines and for care. Our residents do work with Connections for the Homeless. So we are integrated into the Evanston nonprofit community. And yes, we do serve a homeless population. We reach them any way we can. The city of Evanston, and I'm so sorry I keep saying Chicago, like I live in the city of Evanston, will bring patients to us. And the city of Evanston will reach out to us if they have a particular patient that they would like for us to see. And we have some backdoor policies for them, so they can just show up and we make sure they get taken care of.
And I just want to add one thing about that. So sometime in 2021 or the end of 2020, the Connections for the Homeless team lost their psychiatrist, their consulting psychiatrist, and basically turned to Erie and said, and we don't have a psychiatrist in the office every day by any means, but we have psychiatric physician assistants, and we have remote telehealth for psychiatry services, but they have to get behavioral health evaluation first. So it was a very we didn't want the population to be left high and dry. We also had to really tease out. So several of those patients got referred to our medication-assisted treatment for treatment of opioid use disorder and other substance abuse disorders. And I mean, I had Elena, the nurse from Connections, on my speed dial on my phone because we would be back and forth about individual patients. She works really closely with our front desk staff and our operations staff at the office.
I want to answer a couple of questions. So our patient navigators did we mention navigators? Patient navigators are people who help patients enroll in the Affordable Care Act, Obamacare. And so they support them in making sure they can enroll in health insurance, or they enroll in the marketplace if they don't qualify for health insurance. So that's the answer to that question. Do we provide abortion or other related services? As a federally qualified health center, we are not able to provide termination of pregnancy or abortion services. We are able to provide options counseling, which means that we can talk with a pregnant patient about their options. And we can provide them with a list of places that do provide abortion services. We are just not able to drive them there or pay for their services, but we are schedule their service for them, but we are able to point them in the right direction if that's what they choose to do. Liz, do you have anything else to add to that?
Well, we get asked the same question around things like, do we provide mifepristone, the abortion pill? And we don't, because of the same federal issue. It's similar to, frankly, we're in the same boat with the situation around marijuana verifications. Like, even though in Illinois you can go into a dispensary and you can get a marijuana card for certain conditions. Well, you could now, you can get it for anything, but you could get it for certain conditions. We weren't allowed as an FQHC to verify people for those, to say whether or not they were eligible by on the basis of their medical condition. So we just have certain rules that we have to abide by as a federally qualified health center. Having said that, we are extremely supportive of reproductive health justice and reproductive choice. And we train our residents and our other trainees in making sure that they aren't judgmental of people and that they use the right terminology when they're talking to patients about their options regarding a pregnancy. So even to the language, right? Like, not, do you want to get rid of your baby? But, what are your thoughts about this pregnancy, and what would you like to do with the pregnancy? So I think we're in a bit of a quandary in terms of what we can officially do, but we're extremely supportive of our patients making whatever choices are right for themselves, their bodies, their families.
Thank you, Liz. I'm going to answer the question about workforce issues, and then I'm going to turn it over to Missy to answer the question about role of volunteers and at Erie Evanston. I also want to mention that I will send this slide deck to you, Lois, if that's okay, or whoever I should send this to. And it will have the link to the advocacy, to sign up for the advocacy alert. So we will make sure you get that so you can then link to that. And I see that we have a question around, do we negotiate with private insurance companies on behalf of your payer base? We negotiate with, if you think back to the slides, the majority of our insured patients are Medicare and Medicaid. Those are pretty set programs. We negotiate on contracts around that. And some private insurance companies we negotiate with, and generally we accept Blue Cross Blue Shield PPO, we accept United Healthcare. They're just a much smaller part of what we do, but we do accept and we do negotiate with private health insurance. So anyone can come to Erie if you have private health insurance. The workforce issues is something we've been working very hard on. I don't know if you know about this specific to healthcare, but we work, our clinical providers, our medical providers work hand in hand with a medical assistant, and the medical assistant calls the patient back, they room the patient, they do all of that. Our biggest shortage during the pandemic has been that medical assistant role. We have lost medical assistants by the dozens because of family crisis or because their children were not in school. And so they had to be home with their children, and they've just decided it's not worth it anymore for us to work in this role in this setting. We're starting to get some of those people back, and we've had to change our model at Erie. Now we don't only hire medical assistants in that role, we're beginning to hire nurses in that role as well, because nurses are staying in the workforce more often than our medical assistants right now. And so our biggest issue is our frontline staff. They're weary in the moment, and they are staying home and taking care of their families, and we support them in whatever they need to do. And we're desperately looking for additional medical assistants or nurses to fill that role, that patient-facing role. I will say we have a NEMA program. It's called the NEMA program at Erie, and it's a training program for medical assistants. We have a new class. We take applications, and we host that program at Erie Evanston Skokie, and so we have a new class starting in about 2 weeks. And so we are finding that Evanston, there's some Evanston and folks who live in the Evanston area who are applying for the program, and we're happy to have them and train them as medical assistants.
Just as a one thing to just highlight and celebrate is that one of our longtime Erie medical assistants, who is our trainer for other medical assistants coming in, is Shanika McIntosh, who is an Evanston native. She herself was raised in Evanston. She's raising her kids in Evanston. Her son is in the marching band at ETHS. And she just won the Mary Burns Award for Erie for excellence for an Erie staff member. And I've seen her on one of the Evanston Community of Parents Facebook groups. And, she's just very proud Erie mom and a very proud Erie Evanston Skokie staff member who always has a smile on her face and kind of brings the best of herself to work every day.
So Missy, would you like to tell people about your involvement and then how they might be involved?
Let me unmute myself. I was thrilled when I found out that our local health department was applying for a federal grant to start a health center. That was probably 9 or 10 years ago. I worked in graduate medical ed for a number of years, and when residents rotated through federally qualified health centers, it changed their lives. So that was a piece of history that I just beam with pride. I believe our Friends of Erie group started shortly after the health center opened. And we would meet, I'm thinking for a while, almost every month, every other month. The last 2 years have really put a strain on that. But I recently talked to the other co-chair, Kathy Tisdall, and we're gearing up to kind of start meeting again. But what we typically did was reach out to community members, particularly elected officials. We wanted to get them over to the health center to learn more about it. And there were a number of presentations, often but not always, made by one of the medical directors over the years, so that they had a real feel for elected officials, not only the alderman in the ward where the health center is located, but a real sense of that. And some of the staff members from the school-based health center would come over. And this was in the early years, building those relationships. We tried to have a quarterly program that often the medical director would address in person if there were a particular health issue in the community or something in terms of maybe the fall, getting immunizations for young people, etc. We had a panel, one of the last live events I remember, looking at diversity, etc. We're always reaching out to Skokie and typically had a member from the Skokie Health Department in our friends group so that perspective was represented as well. I think many people from the Friends group participated in Erie Moves, which was a very fun event. I was so proud of the miles I logged in the 8 weeks until I saw the recipient of the award who did 800 miles of some kind of activity. That was a fun event. So we will be coming back together to kind of redefine our mission, you know, in the overlay of COVID at that particular time. And we are very excited about working with new moms and maybe doing some fundraising for books and some other programs. I had a recent email exchange with Kathy Julia recently, who's a good connection for us, etc. So we will be doing some specific program planning and really look forward to input about what makes the most sense and how we can support the mission in a number of various ways. So Rob and I will certainly be getting back to you. And I hope that Dr. Feldman, I think, has expressed some interest in joining our group, which I hope you will be able to do, and possibly Lois, always recruiting people.
Absolutely.
So we will keep you updated and hope there's some back and forth. Our group has not done kind of active fundraising, but that might be something to do, getting the word out, etc. So any questions about the Erie group?
Well, if I can just tag team on what you said, Missy, because the question about volunteering is challenging for us. So we love the idea of volunteers helping with publicity. One of the challenges is the HIPAA issues with volunteers in the health center. And so that has been a concern as far as, you know, not being able to be patient facing in any way or come in contact with patients. But if Friends of Erie Evanston is doing more outreach events, staffing, you know, tables, there is a community engagement team at Erie Family Health Centers across the whole system, which would be happy to work with friends and with perhaps volunteers in certain ways, certainly handing things out door to door within their local neighborhoods in Evanston for sure. So I think there are ways I don't know if Robin, you want to add anything about volunteers.
No, I think that's
Okay.
great. Thank
Yeah.
you. I did see there were two other questions I'd like to just quickly react to, if that's okay. So yes, Elizabeth, there are unmet needs in Evanston, and we hear that as well, that there are unmet needs. We work with our community partners to try to make sure that we are getting into our clinic the most vulnerable people in the community. And we work with the city of Chicago, city of Evanston, the police department, the health department. We send people to sit on those committees and to work one-on-one with the mayor, with the health department, with Ike Okubo of the health department, and really make sure that they think of Erie first when they have a citizen of Evanston that needs support. So if you have ideas, we are always happy to hear them. We have a whole team of people who are in the community, who are community outreach people.
And can I follow up with that and ask about finances? And if you had more money, could you do more to reach out? Or if you reached out and got more patients, then would that provide the additional revenue you need? I mean, what's the balance between the work you do to provide services and juggling your different sources of revenue?
Mm-hmm.
I think you mentioned a physical expansion of the center.
We did.
Would you envision another physical expansion, or how do you see growth in the next 10 years? Maybe that's
well. Our goal is to double the patient volume at Erie Evanston in the next 5 years. That is our goal. So we need everybody's help to do that. And really, we need more doctors, we need more medical assistants, and we need more patients. We have open rooms. We talked about 34 exam rooms at our Erie Evanston clinic. We'd like to fit, that means we can have 17 doctors in the clinic all day, every day. And we're not there yet. What we did during COVID we opened the Erie Evanston Clinic 7 days a week. So we are open 7 days a week at the Erie Evanston Clinic right now, which means we've got a lot of capacity to fill those rooms. We are really working hard to make sure all clients of the Moran Center, all clients of Connections, all clients of Peer Services, all clients all clients being discharged from North Shore without a primary care provider, that they're being told about Erie. They're getting an Erie pamphlet when they leave the hospital. So we are working hard to fill those rooms, and we need your help to just tell people about us, because we know that changing doctors or going somewhere for the first time can be a little scary. And we want to make that really easy and really comfortable for people. So if somebody walks into our clinic and they say, I don't have a doctor, I don't know what to do, we will help them right there, get the forms they need to fill out. We'll help them fill out the forms, and we'll help them schedule with a doctor. So we've got potential for growth, and we want to grow. And so if you've got ideas, we'd be happy to hear them. And I want to mention something that we haven't mentioned before, and I see the note about housing. We have a partnership with Legal Aid Chicago, and they serve Cook County patients. And if we have a patient that comes in and they are at risk of losing their housing for whatever reason, we connect the patient with an attorney through our EMR system. So we are able to connect them, and then attorneys are able to support the need of that patient to help mitigate maybe losing their home, or a rental dispute, or helping to find them more stable housing in the future. So we do some of that. We also are part of a service called NowPow, which is something that is also integrated into it was developed by the University of Chicago. It's integrated into our EMR system. And so if someone comes to us and says, I'm afraid I'm going to lose my housing, I need to figure out how to get Section 8, or I need shelter, then we have the ability to click on some buttons and pull up those resources and really work with the patients on those resources. We know that housing is critical to health. And so we work with our internal teams, our care managers, and we work with our external partners to make sure that people get what they need and that they're supported. It doesn't ever feel like enough. I wish that we could, be great if Erie could build apartment buildings for those vulnerable patients that needed them, but that's not, that is not part of our mission, and not part of something that we're allowed to do. And at the same time, I've been awfully tempted to bring some patients home with me at times.
Could I just add one quick
Sure.
question to that follow-up with the housing? Is there any, generally speaking, where do your employees live?
Mhm.
Our Evanston Skokie employees live in the area. They all live pretty close. I'm just thinking through that. Liz, do you want to answer that?
Well, I think COVID really threw a wrench into all of this. So we do have a whole bunch of staff, providers, as well as medical assistants and other support staff who do live locally, live in Evanston, bike to work or walk to work. But we do also have to shift people around sometimes, and especially during COVID, that was more so than before. So we had a whole team of the North Side, which would be include foster. So we had people coming up from the city, from our Kedzie Helping Hands office at Lawrence and Kedzie. So I think it's a mix. It's a changing mix.
Thank you.
Are we functioning as an urgent care facility? We do not function as a walk-in urgent care facility. Our patients, we do have urgent care services, and right now we use our Dempster entrance for urgent care services, but patients have to call and make an appointment to come in. We do not have walk-in services right now.
Except for teenagers. Hey, Missy,
Yep.
could you mute yourself? It's hard. There's some kind of, oh, I don't know. Somewhere we're getting some kind of.
Maybe
Never
it's me.
Never mind. No. teenagers who are concerned that they might have an STD can walk in to be evaluated for a sexually transmitted infection, and we will bend over backwards to do the screening and have an MA do the testing, and then if they need to see a provider, to figure out a way to get them into a provider that at that same time. We advertise that mainly to the ETHS school-based health center, so that the kids that are coming from the high school or recently graduated from the high school can take advantage of that service.
And then I noticed the question about rooms and staffing and that sort of thing. We move staff around from clinics. So for example, the foster clinic may have extra medical assistants one day, and so we move people around. We never limit our services based on frontline staffing. And so I had a conversation today. We have issued contracts for family medicine doctors to come and be part of Erie, and we're waiting on those return contracts. We hope that this shortage will end. Right now, we've contracted with a staffing agency that is placing medical assistants, nurses, LPNs on the floor for us so that we have what we need, but that's not a sustainable model long-term. But we are absolutely able to support doctors and patients who need support every single day through that staffing agency. We just would like for it to be, we would like long-term employees to come in and work at Erie. Are there other questions?
I think there was a question about what it's like for a manager to work with a board of directors that's community majority. I don't know if you want to take that.
I didn't see that, but that's an awful lot of fun. They really are interested in things like the patient experience, and because they are patients, they have a lot of feedback, and we love it. We love it because we wouldn't maybe get open and honest feedback from others, and so we welcome it. We are thrilled by it. They're our biggest advocates, and when they decide they don't want to be on the board anymore, they give us a list of people that they think should be patient board members. They serve on lots of different committees based on their interest, and so a lot of them serve on the patient services committee because they really want a voice in the experience that our patients have when they come to Erie. They also serve on the finance committee because they're interested in our finances, and they want to know how we're doing and that we're spending our money wisely, and we work very hard to do that. So I enjoy our patient board members very much. I think we are a better organization because of their participation.
I wanted to add one thing, tagging on to what Missy mentioned about one of the last in-person events that Friends hosted before the pandemic hit, which was this Faith Communities event, there was a representative from the Morton Grove Islamic Center. There was Rabbi Ari Hart from Skokie Valley Agudath Jacob Synagogue. There were representatives from several churches. I mean, I have a good relationship with Pastor Neighbors from Second Baptist, and I know Robin has some relationships with some of the local churches as well. But I think those are all things that we could encourage and grow. I think really growing our relationship with our faith community neighbors in Evanston and Skokie would be really valuable. So that's an area for growth in terms of ambassadors and advocates. And I do feel, and I don't know if this is part of that question that one of you asked, maybe it was Betty, but in some ways, Erie is a little bit of Evanston's best kept secret. It's not for the 12,000 patients who come to us and their family members, right? But there are pockets within Evanston that are not aware of the extent of the breadth of the comprehensive nature of the medical, mental health, and dental services that we have available. And so any thoughts. I mean, I think maybe that Friends of Erie Evanston might want to host kind of a brainstorming session to get your ideas on other ways to get the word out, especially to our vulnerable pocket of communities. I mean, we have a good relationship with several of the organizations that Robin mentioned, also Kurt's Cafe, also the YWCA and their shelter. So there are certainly, I mean, they reached out to us during the pandemic early on for like, how do we screen the moms who are going out to work during the day and then coming home to the shelter in the evening. So there are relationships that sometimes fly under the radar and that people who need to know are aware of us. But I do think that there's real opportunity that we'd love to welcome any of you who are interested to help us grow.
Well, thank you very much. That was a wonderful program. And I agree, Liz, that Erie may be seen by some as the best kept secret in Evanston. And we'd like to really spread the word about what a wonderful job and how you meet the unmet needs in the community. So thank you very much for coming tonight. And I think we've learned a lot. Thank you.
Thanks. Can I respond to Betty's question just now? Because this is something that Robin mentioned that we didn't really touch on really briefly, which is our relationships with North Shore and St. Francis. So they don't provide personnel directly to work on site at Erie, but they have entered into a very powerful relationship with us, which is to say, when we do a financial vetting for a patient, if a patient meets a sliding fee scale and the scale is, let's say, down to 10%, then North Shore has agreed to accept Erie's financial vetting. They still need to register the patients and go through a financial themselves, but they've agreed to accept whatever the scale is that Erie has set. And on the other side, place like St. Francis, we do all of our mammograms for women who have no insurance whatsoever. They are part of the Illinois breast cancer screening program, breast and cervical cancer screening program, and they do all of those services, including follow-ups and cone down views and everything else, biopsies for women who have no insurance because they're coming through Erie. So there are many ways in which we could not provide a full spectrum of care to our patients without those relationships with North Shore University Health Systems and Amita St. Francis.
Thank you.
Thank you very much for having us. I'll send the slides to you, Lois, and you can get
Yes,
those.
please.
Okay.
Okay. Thank
Great.
you.
Thank
All right. Good night, everybody.
All right. Thanks,
Thank you
everyone.
so much.
Thanks for having us. Bye.
you. Take